So my career goals have really been to be able to provide equitable health care for all patients with neurologic disease, both here and globally. In addition, I hope to inspire or hope to foster strength and inspiration in the next generation of physicians to be able to lead that charge, in addition to teaching other providers how to treat neurologic patients. As such, I have a very busy clinical practice where I treat patients with typical and atypical movement disorders at Stanford University, and where I direct the multidisciplinary Huntington's disease and genetic ataxia clinic. In addition to that, I take my work globally to Haiti annually, where I can provide neurologic care and treat and teach the providers there how to treat neurologic disease. Back at home, I spend a great deal of time teaching the medical students from the day that they enter medical school to the day that they graduate, such that even if they don't choose a career in neurology, they feel comfortable diagnosing and initiating treatment for neurologic patients. In my leadership journey, I think figuring out creative solutions in which to help both patients and students understand neurologic disease. In addition to that, I really hope to foster diversity, and I think the future of neurology is in a diverse group of providers that represents the diverse group of patients that we treat, and being able to provide access for all of those patients.
Our presentation at AAN took place on Saturday, kicked off the annual meeting, and was designed to highlight women in neurology, not only all of their achievements, but all of kind of the challenges, and give us a space to discuss what common challenges we may experience as women in the field. We followed the Women in Neurology course that had taken place earlier in the day, and we had sent out earlier this year the question of what dilemmas or what challenges were they experiencing in their workplace, or other challenges they were experiencing as career women. And we wanted to talk about those challenges during our presentation. We saw when we looked at those responses that they kind of grouped together in common themes. One being how do you negotiate as a woman, and another being how do you, or that there was a struggle of women that were doing the work without necessarily getting the title or getting the recognition. How do you present yourself? How do you get respected as a woman? How do you present if you are more forward and assertive? And so we discussed those things amongst ourselves in presentation, and found that we had all experienced those in some respect as well. And so we kind of divvied up the responses, and each one of us took one of the particular challenges, but then had a discussion on stage. And at the end, we invited women to come up and ask questions if we hadn't covered their topic, or if they wanted to discuss something in more detail. The AAN Emerging Leaders program is one of several leadership programs that the Academy has currently to develop leaders in different areas. So emerging leaders are for those who are more junior in their career. So I participated in this program over not this last year, but the year prior. And you apply, you get chosen in in October, you go to the fall conference, you get grouped into 2 groups, and you work on a project together with, I think, 8 to 10 other individuals over the course of the next several months, and present your project at the annual meeting in April or May this year. and then graduate from the program. And then during the program, not only do you get that kind of hands-on working with other people, learning to develop your leadership skills, but there's also formal leadership coursework that is provided by the Academy. And I think that it's a really great opportunity for developing neurologists to participate and learn kind of leadership skills, but also learn about the resources within the Academy for them. And then also it kind of jumpstarts your career into giving back to the Academy for all that they've done for you.
So many young women in their career get advice about their CVs, about how to get an R01, about when to have children. But in reality, the best advice that I have for young women is that they've got to know themselves. Once they know themselves and they know their value systems and what's important to them and what they want to prioritize in their life, then all those other decisions follow. Then they know the career path that they want. And so it seems almost self-indulgent to spend a lot of time thinking about yourself and what you want, but it can actually save a lot of time and a lot of struggle in the future. And the earlier that someone figures out what they want, the better off their career and their life will be. And so oftentimes when women are looking at leadership programs, they often think, well, I'm not interested in administration. I don't necessarily want to go into leadership. And so one thing that's important for women to know is that leadership is often about how do you make your surroundings better? And so what sort of opportunities are available if somebody is interested in how can I make things run more efficiently? How can I influence my corner of the world? And there's a lot of opportunities. There's, of course, the Women Leading in Neurology group, which is, I believe, like a 9-month-long program that involves personal coaching, as well as so many different other key elements that someone needs to be able to have a successful career. But in addition to that, there's the Emerging Leaders program for those less than 10 years out of training. There's the Transforming Leaders program. There's for those who are in private practice. There's practice management. There's really just so many different options within the Academy, as well as at most of the annual meetings. There are also opportunities to sign up for courses for those who aren't able to do the more intensive programs. In addition to that, I think that people need to sort of look for the opportunities where they are. So within their own, if they're in an academic center, the Office of Faculty Development, to really spend some time planning ahead throughout the year, like what courses they might do. In addition to that, there's a lot of things that are available within business communities that physicians and other healthcare providers would really be much better off if they knew some more about the different leadership opportunities, even within their own community.